body is always engaging in homeostatic balance to maintain functional integrity. Okay? So, now, and it has wisdom. Remember, it's divinely crafted. This is a divinely crafted machine. It does not make mistakes. This whole concept of autoimmune disease, again, is our insanity thinking that the body made a mistake. It can't make a mistake. It can't. Neither can water make a mistake when it's rolling downhill and go the wrong way. It can't. It's not in the possibilities. Okay? Nature always functions perfectly and does it out of necessity. Okay, so now I go to the doctor on 3 separate occasions, and according to the standards of internal medicine, if I have elevated blood pressure above a certain number, on 3 separate occasions, then I qualify for the diagnosis of hypertension. Okay, so my doctor says, you have hypertension. Oh my God, I've got a disease. Now, he says, what we're going to do is we have to give you this magic potion. Okay, and he writes it out. Oh, I get it. Wow. I got to go get my... So I'm going to take this pill, and it's going to get rid of my high blood pressure. Okay? Now, this, you have to understand, this is magical thinking. It's magical and faulty, and I don't even know. So, let's consider what's really happening. What's really happening is my body, in its divine wisdom, knows that it has to keep blood flowing to every cell of my body, to every inch of my body. Okay? Now, however, I grew up in this bizarre world, and I'm eating non-human food. So my arteries are getting blocked. And because my arteries are blocked, the blood can't get to where it needs to get to. So my heart starts beating harder, my arteries dilate, we get the pressure up, and we keep that pressure up. Because why? To save my life. So this high blood pressure, this elevated blood pressure, was done out of necessity to keep me alive. Okay? So it's not a disease that I want to get rid of. I want to acknowledge what it is. It's my body engaging in a homeostatic process to keep me alive. All right? Now, so how do we know that this just might be true? Well, now we've had the pharmaceutical industry, officially took over the medical profession in 1942 with the advent of penicillin. So now we have approximately 30 years of longitudinal studies looking at the effects of antihypertensive medications. What do we find? Well, people that have been on antihypertensive medications over the years have a much higher incidence of cancer in all organs. Now, why would that be the case? Well, remember, the body increased the blood pressure so we can get the blood to where it needs to be. So we came along with a drug that artificially lowered it because we're so clever and nature's stupid, which means we don't have enough oxygen going to all the cells. And what is one of the prerequisites for cancer? Hypoxia. Okay, so that's just an example of how clever we are. You wouldn't believe how clever we are. Just look outside. Just look outside. You can hardly see any nature. We got these things, these machines. We're proud of our machines.